Hey guys, this is Dr. Hub. Today we'll look at the medial as well as the longitudinal arches of the foot. So let's look at the diagram. So what you're seeing here is the lateral longitudinal arch, and this is the medial longitudinal arch, and in between there is also a transverse arch which is present. So looking at the basics, what are the structures, the bones in the foot? So the one in the towards the end will be the phalanges, and next will be the metatarsals. Then comes the cuboid. Then there is also the calcaneus, the talus. Then the cuneiforms are present. Then the navicular. So these are some important structures. On the other hand, this is the next view, that there is a calcaneus, there is presence of talus, there is also the navicular, there is a cuneiform, then is the first metatarsal as well as the phalanges are seen. Now let's go on to comparing the medial longitudinal arch and the lateral longitudinal arch. So in terms of the medial longitudinal arch, so the medial longitudinal arch, we are writing it as MLA, and here let's look at the pillars. So features, there is something known as the A pillar. The A pillar is nothing but the anterior pillar. So what are the structures? So what do you have in the A pillar? There is presence of talus. So there is presence of talus, there is also the navicular, and there is 3 cuneiform, and there is presence of the first 2 and 3 metatarsals. 1, 2, 3 metatarsal. Then we look at the posterior pillar. So in terms of the posterior pillar, what do we have? So under the posterior pillar, there is presence of the medial half of the calcaneum. There is medial, the medial half, and this is of the calcaneum. Then we move on to the main joint which is involved. So what is the main joint in terms of the medial longitudinal arch? The main joint is the TCN. TCN here stands for the talocalcaneo-navicular. So it's talocalcaneo-navicular joint. So what is the summit? The summit here is the superior articular surface of talus. So it is a superior articular surface of the talus. Now let's look at the extremities. So under extremities, there is a pious. What do we have? So there is the tuberosity of the calcaneum posteriorly. So there is the tuberosity of the calcaneum, and this is present posteriorly, and also the heads, and this is of the first, second and the third metatarsal anteriorly. Then we look at the ligament and the intersegmental ties. So in terms of the ligament and the intersegmental ties, there is the plantar calcaneo-navicular ligament. there is presence of the plantar calcaneo navicular ligament. So this is nothing but the spring ligament. This is nothing but the spring ligament. So what are involved in terms of the tie beams? So under the tie beams, there is the presence of the plantar aponeurosis. There is a plantar aponeurosis. So plantar aponeurosis will be the medial part. So this is nothing but the medial part. And there is also the presence of the abductor hallucis. There is abductor hallucis as well as the medial part of the flexor digitorum brevis. So there is a medial part, and this is of the flexor digitorum brevis. So we are writing it as FDB. So what about the slings? The slings here are by the tibialis anterior. So we are writing as TA, tibialis anterior, tibialis posterior, flexor hallucis longus, that is FHL, as well as the flexor digitorum longus. So both the longus are here, flexor hallucis longus as well as the flexor digitorum longus. So this was about the medial longitudinal arch. Next, we will look at the lateral longitudinal arch. So in terms of the lateral longitudinal arch, what is the anterior pillar? So in the lateral longitudinal arch, the anterior pillar is going to be the cuboid. So laterally, it will be the cuboid and the fourth and fifth metatarsals. So it is going to be the presence of the cuboid as well as the fourth and the fifth metatarsals. Next, we look at the posterior pillar. So in the posterior pillar, there is the presence of the lateral half of the calcaneum. So there is lateral half, and this is of the calcaneum. So what are the main joint which is involved? The main joint involved here is the calcaneo-cuboid joint. So we are writing it as the CC joint. Then comes the presence of the summit. So under the summit, what is present? So under the summit, it is the superior articular surface. So it is a superior articular surface, and this is nothing but of the calcaneum. So it is of the calcaneum, and it is at the level subtalar joint. The level of the subtalar joint. Then let's look at the extremities, that is the pious. So under extremities, the lateral longitudinal ligament, it is the plantar surface of the calcaneum. It is on the plantar surface, and this is of the calcaneum. The plantar surface of the calcaneum posteriorly, and the heads of the fourth, and the heads, and this is of the fourth, heads of the fourth, the fifth metatarsals anteriorly. So then comes the ligament and the intersegmental ties. So under the ligament and intersegmental ties, there will be presence of the long and short plantar ligaments. So there is long as well as short plantar ligaments. Then looking at the tie beams, so under the tie beams there is presence of the plantar aponeurosis. So there is the plantar aponeurosis. So this will be nothing but the lateral part, and there is also the presence of the abductor. So there is abductor, digiti, minimi. Then let's look at the slings. So under slings, what are they? So under slings, in terms of the lateral, there is the presence of the peroneus longus and the peroneus brevis. So PL and the PB, peroneus longus and the peroneus brevis.